May I remind members that this meeting will be webcast for live or subsequent broadcasting by the council meetings due to a select time. That members of the press public may record and take photographs, except where they are confidential or exempt items. Can I remind officers and guests joining on Teams to please keep their cameras and microphones off unless speaking. Please use the raise hand button if they want to speak. Item 2 is the election of the Deputy Chair, and this is to formally appoint Councillor Rob Pocock as the Deputy Chair. This item is included from the formal meeting in June. So, assuming you still have to do that, welcome on board. Thank you for that.
Can it be noted that that was on the Chairman's casting vote?
Hey, come on, universal acclaim is the word you're looking for. Universal acclaim.
3 is apologies. Do we have members of the officers that any apologies due from this meeting? No. Declarations of interest. Can I ask members if they have any declarations of interest to make?
Thank you, Chair. Just to declare that I am a trustee of Birmingham LGBT, which is a charity that provides sexual health services, and since it's referenced in the report, I thought I should make that clear, but the city solicitor says I can still take that.
Okay, thank you for saying that. Don't get the clarification. That comes on to next action notes and matters arising. We've got a number of these to go through. The first of which is we need to approve the action note from the meeting held on the 29th of March. Now, obviously, some people in this meeting weren't actually on the meeting at the time. Could I ask the people that were if they got any particular points that they wanted to actually raise? No? Okay. Members, the action notes from the informal meeting on the 19th of July. Anything to raise about that? Okay. Then we've got outstanding action from the 21st of December. There was a request from ESOL Integrated Care System for important data on place in West Birmingham. Maps to circuit were circulated to show the alignment between the DCNs, clusters of GPs and the localities on the 23rd of August. Can I ask members if they actually received them? I'm assuming that people have.
Just to say, Chair, I have received them, and since we spent such a long time asking for them, not getting them, perhaps we should acknowledge with thanks that we've had what we asked for eventually.
Okay, this is a point from the 19th of July meeting regarding to the adult social care performance monitoring reports. Andrew Marsh agreed to try to obtain the information requested for a new indicator which measures the length of time when someone is discharged to assess from hospital and the wait before a package of care is in place. Let scrutiny officers know how this was being progressed. Sadly, scrutiny officers followed this up, but no information has so far been received. But yes, when we actually last had contact with them this morning, did their responses for it?
Responses still documented.
Chairman, you'll recall that when we had the discussion with Jonathan Brotherton from UHB, this specifically came up as an issue. And I said in the conversation that I would take it up within the City Council, because I would guess that a fair amount of the delays, and don't let's lose sight of the fact, and I will probably raise it with Councillor Khan in her report, that one of the pieces of information that came out from the conversation was that at any one time, there are 160 beds within the UHB group that are inappropriately occupied, e.g. bed blockers. Now, it may well be that some of that 160 are grateful tenants of the City Council who may be waiting for adaptations or for a care package to be put in place by adults and communities. And therefore, I think that this information is of paramount importance, because we've all seen the news reports of ambulances queuing up at A&E or UE, to give it its proper name, at acutes. There's no way for them to go. And if we've got 160 beds inappropriately occupied within acute hospitals, I think it's incumbent on us to play our part as well.
Absolutely. I couldn't agree more with that, County tells me. Did you get an indication on in terms of when you suppose that? I think we just need to get back to is line manager in terms of what the actual problems in terms of getting that information. Because it has been requested 2 months ago. I think I can't understand why it's not available to us now. Councillor Pocock.
Yeah, fully support you there, Chair. It's a serious issue. The biggest, one of the biggest crises facing the whole health and social care system is this issue of discharge. We currently have no measure of delayed discharges. So we've lost detox. We've got no measure of the queue, as it were, in the hospital. We've got a indicative figure, as Councillor Tilsley has said, from the integrated care system. I think Jonathan said he would be prepared to supply us with his data on a regular basis. So I think we've got 2 actions here: to go back to Jonathan Brotherton and say, can we then have at least the numbers in your system who are inappropriately located in hospital? Secondly, we've really got to turn up the heat on some indicator, because at the moment we're flying blind. We know there's a problem. We've got no measure whatsoever of what the scale of that problem is, whether it's getting worse, and yet this is one of the biggest crises affecting the whole system. So it's a matter of really important priority that we press on this. So I'm reinforcing your point, Chair, that if we can express this in the strongest terms, I think that would represent, I guess, a consensus on this committee.
I would assume the entire committee would agree with what you're saying there, Councillor Pocock. It generally does concern me that 2 months later, it's still not been able to come up with the information. And I think if they're not able to do so, we need to know why they've not been able to do so.
Agreed.
Maria Gow has been asked to confirm when the detailed report containing constituency level data could be presented to the Commission on an annual basis. Scrutiny officer would follow this up, but as when I last spoke to Gail, no information has been received so far. Information. So I think again we sort of need to be flagging that up in terms of why that information has not been received. Again, if the request was made 2 months, if there's a logistic reason in terms of why it's not available, we need to know what that is. I think the committee is as it makes a request for information, that request on it. No, down here that Maria Gavin to invite a safeguarding leave to attend the 5th September. That's what we're initially looking to do. That's now going to take place on the 18th of October, because the report won't be presented to Cabinet until the 11th of October. So Health Watch Birmingham Annual Reports 2021-22. The Opportunities Report, which is due to be published by the end of July, was forwarded to members before the informal reading on the 16th of August, and I understand that the reports were circulated to members. Members received those? Thank you for that. A copy of the Living Life to the Full Dementia Scrutiny Report was presented to the City Council in November 2014. A copy of that was circulated to members on the 19th of July to see if they got any concerns regarding the strategy at that particular time. I take it members received that. I recall getting some. Okay, were members able to respond?
Received it.
We should at this stage be getting a report from Cabinet Member and Graham Betts on the Cabinet Member's report for health and social care. I understand that Graham Betts has been delayed a little bit. Is he due to be about 10:30 still?
Hopefully, so I know that he's presenting on an ENT, and that's scheduled to end around 10:30.
So what I'd like to suggest is that we move on to item 7, which is the tackling period property and raising period awareness report. We've got 30 minutes for this item, so I'm going to suggest that we spend no longer than 50 minutes on presentation and 50 minutes for questions. And Monica, who's the service lead for Inequalities from Public Health, will be presenting on the item. So if you have to get over to yourself.
Thank you, Chair. So thank you for the opportunity to coordinate and present this update. I will present an overview of activity in progress against all 3 outstanding recommendations from the committee. Some of them, so 2 of them are actually led by other departments, other colleagues. So in case there are any detailed queries that I had no response to, I'll gladly take them away and seek clarifications. So the first outstanding recommendation was recommendation 3, which is around the feasibility of commissioning a research programme aimed at establishing the nature and extent of period poverty in the city, and also with including a focus on cultural attitudes and how the diversity impacts on that. This recommendation has been completed. As previously reported, it was not feasible to undertake an extended research with school children on the topic of period poverty, and this was due to logistical challenges of obtaining funding and the requirements for ethics compliance, which would make the work disproportionately time-consuming. Instead, we conducted a focus piece of exploration with West Birmingham schools and have used the findings from other local research carried out by Spring Housing into the vulnerable communities. The focus research carried out with 2 schools identified that there is no issue with supply of period products. There's sufficient access to those products across the city and within the schools. The issue that has been identified as part of that research is that the girls do not come to school during their periods, and that has been explored a bit further. And a session within the George Dixon Academy was conducted together with a local GP to explore these issues and share information further with the girls. As a result of this focused research, we know that the work needs to continue to increase awareness of available support and understanding and reduce the stigma around periods so that we can reduce absenteeism in schools. And a toolkit for education settings is being developed between our education colleagues, the GP involved, and public health, so that we can improve the support that is available within schools, but also hopefully tailor that toolkit to other sectors as well. In terms of the next recommendation, recommendation 4, was around exploring a collaborative approach to providing coordination and support to third sector organisations supporting vulnerable women to alleviate period poverty, and that was a particular reference to accessing marginalised communities. So this recommendation has also been completed following a review of period product supply and research into the needs of homeless and vulnerable women. It has been identified again that the supply of period products is sufficient, and distribution across the third sector is being improved further. So further bulk donations to third sector organisations working with vulnerable women have been secured, and more supply chains are being actually still explored and secured. Work is in progress to ensure they are distributed appropriately and accessible to vulnerable women. And the distribution chain also includes exempt accommodation providers, so that we can reach out to as many women as possible. Mapping of places where women can access shower and wash facilities has been also carried out by a multi-agency working group that we've established to look at this issue. And all these places have also been supplied with sanitary products and clean underwear to be used by the marginalised women. These locations have been incorporated into the street support handbook and will be published on the BVSC website as well, so other organisations know how to and where to signpost women. The Active Wellbeing Society is maintaining an oversight of all of the sites where the products are stored and where they're being distributed from. The coordination is actually carried out by a multi-agency group. What's interesting as part of this work, a research has been carried out by Spring Housing into women and who are rough sleeping in Birmingham, and that research has highlighted that, again, education and awareness around both period poverty and menstruation itself was very low to non-existent in the homeless sector. And there were concerns, particularly around male staff members who were simply not comfortable to talk about menstruation and support vulnerable women they may have been working with. So a training proposal, including a toolkit for homeless settings to address this, is also being developed by Spring Housing with the support from the homelessness services and public health. And the final recommendation that has been outstanding was the recommendation for the procurement colleagues to explore the possibility of including a clause about alleviating period poverty and raising period awareness for inclusion in future contracts. This recommendation has also been completed as far as it is possible within the legal obligations. The social value guidance document was amended to include a statement around alleviating period poverty as part of the potential provider's social value responsibility. And the exact wording for that has been used within the guidance and suggested for contracts has been quoted within the report. This amendment was incorporated in the December 2021 update of the social value documents, together with other amendments as approved by the Cabinet in October 2021. There's been two further recommendations from the committee around that. One to around inclusion a clause of alleviating period poverty as a condition of contracts, and the other one is around period poverty, inclusion of alleviating period poverty in the weighting of the scoring of potential bids. And this is not just in the ITT stage, but also in the assessment stage. And the procurement response to that is that contract clauses must be relevant to the specific contract as stated in the Social Value Act. Therefore, alleviating poverty is not relevant to every contract and may not necessarily be included specifically as part of the conditions. The same goes really to the scoring element, but the scoring has been suggested to relate to the social value element. And if period poverty is relevant to the contract to be included in the social value element of the contract, then the scoring should be weighted accordingly on that within the response. In other words, if a specific issue such as period poverty is relevant to a particular commissioning or procurement exercise, then it should be referred to in the social value questions. There's been further steps, though. There are further steps to be taken around this, and some of it has already happened. There needs to be more communications sent to relevant contract managers to remind them about the period poverty clause and these provisions. And also articles to be produced linked that by the Public Health Division, supported by CPS, to ensure that this is clarified as well. So basically, this is an update on the accommodation.
Okay, thank you very much for that, Monica. Members, any further questions or observations?
An observation and a question. I think the observation would be positive. I think the whole point of this report was to get these actions happening, and I think that it's identified a number of steps which are now being taken. I think that's over the period since the report was issued. I see progress, which is good, and it's also highlighted in your first section the issue of stigma in period awareness, menstrual awareness in schools in particular. I'm concerned, obviously, about the issue of absenteeism that's been raised. Our previous member, Peter Fowler, thank you, was raising this point. He made this very point. In fact, we broadened the remit of the report to pick up this period awareness, menstrual awareness issue, particularly amongst men. So I think you've hit on a very important point there. So I think just a flag, it would be good to see more progress on that. We've unearthed an issue here. Clearly, if there are girls missing school, and it may be that there's an inequality dimension to that too. I think this carries forward a negative, obviously. So I think we do need to explore that issue further. A question on the issue of procurement. I didn't quite pick up what you said about the relevance to all contracts. Clearly, I can see under the Social Value Act, it's not relevant to all commissioning, but where it is relevant, are we then saying that these conditions or these criteria will be included?
Yes. So it's a standard clause anyway,
Mm-hmm.
but where it is relevant for the contract, for example, there's a useful example given within the report around school maintenance versus school IT supply, for example. So school IT supply not so relevant, but school maintenance may be quite relevant because of the supply of products and making those visible and accessible. So where it is appropriate, then the scoring on the social, it should be strengthened as part of the social value responsibility of the provider, and then the weighting of the scoring as part of the bidding process should be adequately increased as well.
That sounds good. Back to the first point then, Chair. I'd be keen to know how we can progress this issue of absenteeism in school associated with menstruation. I think there may be a parental issue here too. It's not maybe just the young person, maybe family pressures. So I think we need to go into this in more detail as an authority.
There's some work going on with education colleagues and public health to develop this toolkit as a start for school staff to be used in order to hold those conversations, but also raise awareness in a classroom and raise awareness amongst all children, and so that girls may feel more comfortable to approach any of the school staff they trust and they've got relationships with, to have a conversation if they are still concerned, but also they know where to access the support. And it's not becoming a kind of taboo conversation between male and female students as well.
Any other members? Councillor?
Yeah, thank you, Chair. I'm surprised, I welcome the report, but I'm surprised that these issues weren't particularly identified during the initial inquiry. Obviously, I wasn't a part of that original inquiry, but given the fact that one school says that they have enough period products to pay for the walls of their office, it's a pretty strong statement for them to actually say that. So how was that not picked up during the initial inquiry and the shaping of these recommendations? Because, that is a very, very bold statement for them to say. And given obviously the issues around period poverty, it struck me that why was this not teased out? Did we not speak to schools during the initial work that took place? So I'd like an update on that. And then in terms of obviously, there's talking about Birmingham in the context of a super diverse city, but the update on the recommendation just refers to 2 schools in one part of Birmingham. Is that an accurate reflection of the rest of the city? Because obviously Birmingham is a super diverse city, but that doesn't mean one part of Birmingham is the same as other parts. So is there any wider work to make sure that the issues experienced in those schools is reflected elsewhere? And we're not going speaking to 1 or 2 schools and just assuming all schools are in the same scenario. Because it's really important that if there are schools struggling with access to period products, that we perhaps be sharing them, rather than having one school decorating and one school having a shortage. And then in terms of the procurement, I'm just slightly confused in terms of what we're actually expecting contractors to do, because we've just heard in the recommendation 3 that schools, it's not necessarily an issue of access to products, it's awareness and attitudes towards periods. So what exactly are we going to want these contractors to do? Because I assume the default thing they would want to do is just buy more period products, which clearly is not an issue if schools are pairing walls with them. So what exactly do we want them to do? Because I'm just slightly worried that the default they will do is, right, okay, well, here you go, here's a load of tampons, our job's done, and it actually hasn't achieved anything that we're set out to do.
The first question, I'm not sure why. We have the first inquiry, so I won't be able to answer that, but I may try and seek some answers for you. So sorry about that.
That's right.
In terms of the is it a kind of a consistent issue across all schools in Birmingham? Probably not. In terms of the supply, from what we've been getting from head teachers, and we've got members of our staff attending different fora, including the education and head teachers fora. In terms of the supply of product, that doesn't seem to be an issue generally across Birmingham. What is an issue is the absenteeism, and this is what we've been focusing on. And in terms of procurement, if it is part of the scoring and assessment because it's relevant to the contract, then there will be an expectation that the provider will provide kind of more of a holistic approach to their social value responsibility rather than just supply of the product, because the supply of the product is often not the issue as identified within the research. So I suppose it will be the responsibility of individual contract managers to be sure that they question and score appropriately, which needs to come through the communications that needs to happen internally more widely.
If I may, Chair, but if the issue is that it's in problems in schools and accessing girls and raising awareness and challenging attitudes to it, I don't see how a contractor for the City Council can necessarily address that. That is an issue that the schools are best placed to lead on. Yeah. I don't think we should be getting council contractors involved in schools necessarily around that. So for me, my worry is the default will be is we'll just buy products and more products, which as you just touched on is not necessarily the issue. So what exactly are we expecting them to do? So holistic's a nice word, but I'd like to know roughly exactly what it is they're going to do.
So it will depend on the type of contract what they are actually contracted to do, which organisations or bodies or groups they are expected to work with. Because there's also the research and toolkits that we are working on with the homelessness sector, and looking at kind of rolling it out if it proves to be successful to other settings. So kind of using that then toolkit by their staff to that is appropriate to the settings they're working with or within to address the issues. But as I said, it would be different potentially depending on what they're contracted to deliver for which groups within which settings.
We've got the policy and governance manager, Sharrett, online at the moment, so I wondered if he made it. Can you hear us, Sharrett?
Good morning, everyone. Thanks for the invite, and this is a really interesting point that we are raising, and it's already been picked up that not only does it need to be relevant to the contract, but also it needs to be within the capability of the contractor to deliver. The obvious one is provision of supplies, and relevant contracts to that may be, for example, school maintenance, hygiene, bathroom hygiene providers for the council and our buildings, potentially food providers to our schools. So these are potential contracts where we could build in period poverty supplies into them. Otherwise, if it is relevant, then we will include it. But as we've said, provision of supplies to schools may not be the primary issue. Also, where we ask, given that cost of living crisis is now a high social value priority, we'll be asking suppliers where relevant to contribute to food banks, and this may be relevant in providing hygiene products to food banks as well as food, because they supply a whole a lot of what is necessary for people. So yes, if you believe that there is a specific contract where this is relevant, then we'll be happy to include it, but also we need to raise it in the consciousness of the procurers and commissioners and contract managers to make sure this is included, both supplies and advice, which as we know is limited in terms of what contractors can provide. Happy to answer any specific questions.
Don't have a supplementary, just confirms my points that it won't raise the actual awareness issue. It'll just provide more products, which we're told there are plenty of.
Well, that is not the aim of the change. So it's not about the supply of the products. So we may, as contract managers or commissioners at the point of commissioning, has asked specific questions as part of the social value responsibility and weight those. But it would be potentially a different approach depending on what type of a contract it is. Supply is not specifically an issue generally, that's what we've identified, but distribution might be, or access, or in terms of education, it's absentees. So it's kind of, it's whatever the provider within their remit are able to support as part of their service provision to a particular setting, the response will need to be sort of, tailored to that.
Thanks, Chair. Going back to the point around the kind of, as Councillor Moore said, the starkness of that comment about we've got enough to pay for our offices, and that question about why wasn't that teased out earlier. I mean, you yourself said you weren't around that point. I mean, I'm just thinking that were any members of the committee who were around on the committee at that point able to remember kind of what, during that inquiry, why that didn't come up at that point in the evidence gathering? I just thought maybe those committee members with that institutional memory might be able to shed light on that one.
I think also we need to bear in mind the context of which that comment was actually made. We've got a three-line comment here, so I'd like to see the context it was actually made expanded a little bit. I understand what you're saying there, Councillor Fitchard, but if it possibly go back to the comment on recommendation regarding George Dixon. They obviously held a session there with your women to discuss some of the issues. They obviously got school and support issues involved. Do you think that those involvement change perceptions among pupils in terms of what they actually need to do in terms of accessing school products and in terms of being able to attend school while they're on menstruating?
So within those two schools, that work has been happening as a result of this focused research. But the issue is now to ensure that other schools have access to the same sort of, information, guidance and support. And that's why the work on the talk is being carried out.
But I'm correct to assume then that those sessions actually made positive differences in terms of people's attitudes?
Yes.
Yeah. And you're looking to roll that out in individual schools? Yeah.
So the toolkit will suggest that. Obviously, it will have to be the schools who organise those sessions with support from health partners, public health. They need to coordinate that because obviously, there's other work going on within schools, so it needs to be planned, and we need to get those schools on board.
Yeah, and when they're rolling it out to other schools, well, Benson School is one of those schools that it's been rolled out to as well. Are we aware of that?
So Benson Schools was one of those that was already involved in the research and has benefited from a lot of sort of guidance as part of this, and so was George Dixon Academy. It's other schools across the city that the work needs to.
I understand it's been rolled out to other schools apart from those two, but the comments that here referred to George Dixon as opposed to George Dixon and Benson. So I just wondered whether.
Oh, this is because there was an engagement by the local GP from George Dixon Academy. And I'm really sorry, I have not been carried out personally this piece of research, but I can get some more detail in terms of what's happened within each of the schools and get back to you on that.
That would be useful, I think, for the community, because at least we know what the impact of those interventions are. And I suppose the other question would be, would they be looking to sort of repeat those sessions within the school as a sort of follow-up?
Yeah.
Possibly because they wouldn't catch all the relevant pupils on the first one. And I think sometimes actually repeating the message could help it to be accommodating more. Okay, thank you for that. Anyone else got any questions?
Very quickly, just picking up on the question Councillor Pritchard raises about institutional memory, I can't. This report obviously was produced just before we hit COVID, so I think we had two factors that got in the way here. The report itself obviously then recommended a piece of research. We couldn't, in the end, I think, get the money for that research. So it's a kind of make, do and mend, which I pay tribute to the way you've done that. But it's a sort of, which was a shorthand way of addressing the issue. I think the other factor we need to bear in mind here, the government actually did come forward with quite a big scheme for schools, actually. So the supply issue, which we thought was a big problem, then did not become a problem. So the focus, I think, switched tack somewhat pretty rapidly after our report had been produced. But I remain keen that we should continue to track the work on school-age young people. Let's just put it that way. This is for boys and girls. And I think not just in schools, because this is a cultural thing outside of school too. Sports and recreation and other settings, I think need to be a focus here. So I think we have unearthed through this piece of work a significant issue for this city. It's one I think our committee ought to keep watch on. Some of the concerns that have been raised by members here, I think might then be addressed as this work is rolled out. But the work in 2 schools is fine, but we have a city of 300 schools. We need to broaden this out. So I'm suggesting, Chair, that we find a way of continuing to track the progress on this front. I don't know whether we can do that through tracking of the report or whether we want to produce a separate assessment after a period of time.
Would there please come in on that as well. Because the role of public health is to provide guidance and promote the guidance or to talk it and contribute to that. But we can't make all of the schools to come on board with this and actually coordinate and deliver all of the sessions. So I think that we need to figure out how the committee would like to and who from the reports on how this is progressing being rolled across.
I think it's a fair point, Chair. I mean, it's not about public health specifically. This is about the City Council and other partners. Our job as a scrutiny committee is to look across that breadth. So,
possibly something else I'd like to take up with Councillor Jenkins.
yeah, okay.
Very briefly, the comment that has just been made by Monica, I think highlights how we work with schools, particularly with the diffused arrangements that we now have within the city. George Dixon are an academy. We still have a small percentage of secondary schools, obviously, where girls are going to be most affected by the period poverty. But it is actually getting through to those schools who aren't any longer within the LEA family. And that concerns me.
And also there's a number of age schools as well where this subject may be quite sensitive and controversial. So the issues are quite complex and it's not so easy to penetrate with guidance.
But that's exactly why I think we need to keep a focus on this, because it is complex and it's easier for a sort of denial to be perpetuated if we don't proactively attempt to break it.
Yes, so I'm one of the people that's new to this piece of work since it started quite a long time before I came into this role. And one of the things I suppose a question to the committee really, and it follows on from the discussion about the recommendations and additional work that members might be interested in, is whether you feel the report to the committee shows that the recommendations have been discharged, so you're happy to accept that the recommendations have been completed as they were originally written, but there may be further work that you want to do to look at this. And I pick up on the point that the chair made around thinks a conversation with Councillor Jenkins, who chairs the Education and Children and Social Care Committee, because something that committee has talked about is the wider inclusion agenda in schools. And just from the brief sort of information we've had at the committee, in my mind, there are some connections between inclusion and this wider issue. Whether that's this committee after that conversation may want to make recommendations to the Education and Social Care, that's something that they want to look at in more detail, maybe a joint piece of work.
I think my own view on, firstly, thanks for the comment, Chair. My own personal view would be, I think the report is sort of completed what it was set out to complete, but I think it's raised a number of additional issues, which I think we do need to be actually into account. Now, whether we do that to standardising this bit lost, or we look to speak to Councillor Jenkins' committee and ask them to take it on, or if it's something we did jointly. I'm open to the committee's views in terms of the best way to move it forward. I think possibly whether it's something that we can do potentially jointly might be better do, because we actually set this up in the first place and there's a clear health implication to it.
I think I support that, Chair. I think procedurally we probably do discharge the report. The report has delivered what we've asked it to do, but it raised an issue, as you've quite right to say, that it went in a sense is broader than period poverty. This whole issue, period awareness, stigmatisation, the negative effects that can have on boys and girls, that's a big issue, and I think we need to find a way of keep opening up that debate and set the report on one side. I think we leave it to yourself, Chair, and other scrutiny chairs to look at how this is an issue that continues to kind of be ticking away on our agenda and not lost.
So are the committee happy that we actually accept the recommendations, but we actually agree through the officers to speak to Councillor Jenkins about some additional work and then bring the initial conclusion back to our October meeting?
Yeah, I wanted to speak earlier, but I was a secondary school teacher for 17 years with various responsibilities, as well as the normal pastoral kind of care that teachers should be offering. I had a specific pastoral senior role. I haven't really gleaned from the George Dixon Academy session how male staff, male teaching staff, actually fit into this situation in terms of punishment, in terms of perhaps releasing girls or boys for that matter, but girls specifically with this, to go to the cloakroom during a lesson. And I'm thinking all the structures that were in place in the school where I taught, which, you know, you can see would have an impact on a girl's confidence and feeling in front of a class where there were boys present. And, you know, as well as on the attendance issue as well. So I just wondered, is there any information on how male teachers these days, male teaching staff, how they are prepared and for their responsibilities in this respect in their teaching jobs?
I think it's something that we need to make some inquiries into. That would possibly include Councillor Jenkins.
I think it could be part of the same discussion.
It'd be difficult enough for a girl to approach a male teacher, full stop, wouldn't it? There certainly are, you know, I've got some recollection of all those years ago of this situation, but that's just, I just wondered whether we had an overall picture of what's going on in the schools in the city, secondary schools in particular.
Speak on that last point from Councillor Hartley. Do we know that the George Dixon sessions, what the breakdown was in terms of staff, in terms of male and female?
I don't have that detail, but I will
Is it possible
inquire
to get that information?
Yes. But there wouldn't be any exclusions for males. It's not for female teachers.
So it looks as if the girls were saying that boys should have some awareness and you know, input on this. I just wondered whether there was anything about male staff.
If you can make sure, you can check that out and then that the office, isn't it? So are we happy to agree to the but we will be looking to do some additional follow-up work to address the areas?
Agreed.
Thank you, everybody, and thank you for the presentation. Appreciate it. So, we've now got a report of Cabinet Member for Health and Social Care, and we have unfortunately got Councillor Marion Conner, Cabinet Member here, who's been accompanied by Graham Betts, Director of Social Care, and Mary Wood, that's the pronunciation. Sorry, who is the Assistant Director for Public Health. Want to get us on?
Thank you, Chair. I'm just going to wait for a moment to see if presentation is going to appear on the screen. Okay, so once again, thank you, Chair, and thank you for members of HOSC for inviting me. It does feel really strange to be on this side of scrutiny, having spent so many years chairing scrutiny and being on the other side. But I will say I am delighted to be here today to talk to you guys a little bit more about what my priorities are as the Cabinet Member for Health and Social Care, and also to hear from members of the committee around issues that are of interest and priorities for yourselves. I'd like to sort of start off also by just saying, you know, thank you to both Justin Varney and Graham Betts and their teams, who have been a tremendous support for me for the last 4 months since I've been in post, and I'm sure as members of this committee are aware that this portfolio is absolutely huge. I kind of, from when I got into post, I already was aware that this was a big portfolio, but the last sort of 4 months, given that we've had a period of the games and also the summer period, has just been a whirlwind of learning and information overload about how much detail is within this portfolio. Just in terms of a background for members who might be, initially I thought that there might be some members who are new to the council, but for members that are here, members who are new to the committee, you might already be aware of the setup, but just to sort of make it clear, my portfolio covers 2 directorates. One is adult social care and the other one is public health. Which is why I mentioned both Graham and Justin. And overall, I see my role as being, as for us to work with both of the, for me to work with both of the directorates, and sort of having an overall objective to deliver a bold, healthy Birmingham. I know that members of the committee have already received a really detailed report, and that just gives a bit of background into some of the areas of work that both adult social care and public health have been doing and are doing. But the purpose for me here today is just to talk to you about what I see as my key kind of priorities, that I just spend a few minutes to discuss and talk through. So my first key priority that I've put down is tackling health inequalities, and I, through the health and wellbeing strategy, the idea and the strategies around creating a bolder, healthier city. This strategy has set out the ambition for the next 8 years, leading us on to 2030, and it looks at the core themes across the life course. So through that strategy, one of the ways in which I'm looking to lead on tackling health inequalities is looking at the different elements within the strategy. And I'm sure members of the committee, if you've had not sure whether you've had a chance to have a look at the strategy, but we can certainly circulate that if that hasn't already been done. Another area within tackling health inequalities is the Black Here report, which is a Birmingham and Lewisham African Caribbean health inequalities report. So for me, my priority now in terms of this report is to look at implementing the findings and building on the incredible report which identified the health inequalities within African and Caribbean communities. The report was published in June of this year, very soon after I came into post. And so now the implementation board is currently being set to launch in October. We've also got a planned event in Parliament where MPs will be supporting and co-hosting to launch that and to continue to highlight some of the findings of that review, and then obviously looking to try to implement them. Another area of work within health inequalities are the community health profiles. The purpose of these are to highlight where there are inequalities amongst various different communities. Quite a few of them are being launched in the next few weeks, so members of the committee will be invited to attend those. I think most of them we're doing them on Teams, so if diary permits, people are able to sign up to those events and attend, and it'll be really useful to be able to have a look at exactly what sort of style and setup that the public health team have worked on, and they've worked with various different communities and looked at where certain things in terms of inequalities exist, and the idea behind those health profiles and the toolkits is to have a community co-produced solution to try and tackle those health inequalities. So we're commissioning community engagement partners to work on tackling some of the issues that are going to be that have already been highlighted and raised, and the profiles are currently in the rollout of being launched and going live. And another sort of final point in terms of health inequalities, I'm really keen on continuing the work that's already started around things like food justice and food poverty, developing the food strategy. The consultation ended 2 Sundays ago, and I know officers are working on having a look at what the feedback and outcomes from that consultation look like, and really trying to shape that, and ultimately doing our best to enable that members and people who live in Birmingham are able to have healthy lifestyles in relation to food. And finally, obviously, a lot of inequalities around health were identified during COVID. Most of them already existed. I think that COVID ended up being a bit of a catalyst to recognise and highlighting them. And one of my priorities is obviously overall looking at some of those inequalities that came out and focusing now on needing to address them. So we can move on to the next slide. This leads on to sort of a post-pandemic situation. I know that members of the committee who were members during the pandemic will remember how majority of the work when it came to health during the pandemic period just focused on the COVID pandemic. Back then, however, it was very much of an emergency situation, and seeing how the city can get ready, how the city and the council and officers can respond to dealing with the pandemic. Now, however, the situation obviously has slowed down as we're in a post-pandemic period. COVID hasn't gone away. It's much more of a sort of COVID recovery period. And obviously, as a cabinet member, I still want to ensure that we keep people safe. I'm working with officers on the vaccination programs that are still being rolled out, and obviously looking at what the learnings from COVID are. And obviously the final sort of bit around that is being alert to some of the COVID, not just COVID, sorry, being alert to some of the winter pressures, such as COVID and flu waves. In terms of another aspect of post-pandemic situation, having a look at and discussing the impact of COVID, including on people's mental health. And sort of finally on this post-pandemic part of the slideshow, I just want to place on record my thanks to the staff and the workforce that worked throughout the pandemic, and especially to teams within public health, a lot of who are either leaving us now or have already left us. I know that they certainly led the way and ensured that that people in Birmingham were helped and protected during that period. I can now move on to, thank you. So my third priority area, which I'm sure is going to be a massive priority for everyone in the council at the moment, is the cost of living crisis, as well as the winter pressures. This is, I think, in terms of where we're at, we're at the end of September and we've got winter approaching us. It's one of the biggest issues for us. It's literally being discussed in every meeting. And I know that members of this committee would either have discussed it in this committee, either in group meetings or in ward meetings, or with other various partners. The cost of living emergency was declared by the leader 2 weeks ago, and it clearly is a very serious issue for all of the families in Birmingham. We're aware of the difficult choices that people are going to find themselves having to make, such as the cost of energy increasing and having to make decisions around the heating of the homes, or whether it's providing food. And like COVID, this is an area where it's clear that the vulnerable are unfortunately always hit hardest, such as the elderly, people who've already got health issues, the poorest, or families with children. There are also clear winter pressures on the NHS overall, and I've been keeping close links with NHS colleagues to stay informed, such as some of the things that were mentioned earlier at the beginning of this meeting around things like ambulance waits, bed blocking, the issues around staffing, and an increase in demand. So my priority is to continue to keep a close eye on the things that are going to sort of unravel in the next coming months. In terms of our overall sort of council response, currently we're exploring all options in terms of how we can do things differently. We're seeking to provide, and this is, I must say, this is just we're looking to see if these things are possible to happen. It's not, there's decisions haven't been made, but I know officers across the council, across the different directorates are looking at these things, such as seeking to provide increased access and advice and helping people claim benefits, training frontline staff, working closely with the third sector, creating a new team of community navigators to support greater access to benefits. On things like warm spaces, we're also seeking to help libraries with additional capacity, and also things like exploring whether leisure centres could offer washing facilities, and if there are any other spaces that could work. On things like eating, we're working with partners on close coordination of food banks and supermarkets, and providing advice on new ways to prepare and conserve food. And also, as already mentioned, winter pressures are going to intensify, and I will continue to be working and liaising closely with NHS colleagues and also with GP surgeries to provide information as part of a Be Healthy winter campaign. And also, in terms of our own workforce in the council, there's already a view of looking after our own workforce with things such as mental health counselling, already continue to pay the living wage, and also looking at an enhanced hardship fund. So in the last few weeks, since we've known that this has been a key issue, have made it my sort of priority. Almost at every meeting that I've had control of the agenda, I've put the cost of living on the agenda. So we've got the Health and Wellbeing Board, which is taking place on the 27th of September. I've made sure it's on the agenda for that. In the last 2 weeks, I've had the Creating a Mentally Healthy City Forum and the Creating a Healthy Food City Forum, both of which I chair, and I've made sure that the cost of living has been an additional item that we've added onto those agendas. And I'm continuing to discuss with stakeholders and external partners to work on having a joint up approach. I've also met with my directors, especially to discuss what more we can do within our directorates to help to support people with the pressures that we've got. And the picture that I've got on that slide, I'm conscious that you're not able to see, but just so you understand what it is, this was just a screen grab of one of the mentee discussions that we had in one of the meetings I've just discussed. And the question that I had as an ask to members of that forum was, what is your organisation doing to help with the cost of living crisis? And it was just an option where people are able to just give their suggestions. And that's just what that is, in case you're wondering what that random slide is within the slide. So that's sort of the end of my third priority. And the fourth priority I've got listed is maternal health. So I'm a mother of 3 very young children, and as I'm sure, that's my children there. As I'm sure you may have already heard, if I've spoken in the past. I am really passionate on health of mothers throughout pregnancy and beyond. I've had, very recent experiences myself, and I've also got stories and experiences from other young women who are of a childbearing age, especially looking at having an interest of women from minority ethnic backgrounds and interested in the inequalities faced by them. Also a priority for me is the rights of all children to have the best start in life and access to good quality basic healthcare in order for them to be able to live healthy and happy lives. One of the things that I did pretty much as soon as I came into post in the first few weeks was I met with a team of academics who were interested in maternal health, and I'm working closely with them to identify some of the barriers and issues faced and challenges faced by women. That's the Dame Hilda Lloyd Network. And I've also started having conversations with both the chief executive and the chair of the NHS ICS for Birmingham and Solihull, talking about what more I can do around maternal health and working through those channels as well. The fourth priority area is mental health. I've already sort of discussed in some of the other priorities around mental health and linking it with COVID and the impacts with the cost of living. But beyond that, my priority is to advocate the importance of mental health for people of all ages and backgrounds. I'm already working with partners to support work that's already happening, and mental health and wellbeing is as equally important as physical health is, and so it was really important for me to include it as a key priority. Some of the things that I'm already discussing within the portfolio is how sports can help mental health better. And I know that the committee are looking to do an inquiry into young people and mental health. I thought that it might have been on the agenda today, but I think that might be moved to a later date. But if that inquiry is going ahead, then I'm keen to and committed to support the work of the committee on that. And I can move on to my final slide, which is the delivery of the Integrated Care Partnership. So I'm the lead representative for the council on this partnership and the vice chair of that. I'm really committed to ensure that the integrated care strategy really and truly is integrated amongst the local authority and the NHS, and how it also meets the health and wellbeing needs of people across this ICS. So that's Birmingham and Solihull. For me, I see that as, I see my place on that as being the voice of the council, and more importantly, the voice of local residents that we're here to serve. I will also ensure that as the chair of the Health and Wellbeing Board, that the vision for citizens is aligned to the priorities of the ICP. And I also see my role as a partnership working, and it's important for me to continue to nurture and build on relationships that already exist, as well as building new relationships externally to work together for the best outcomes for people of Birmingham. And that brings me onto the next slide, which just gives me a bit of context, which, Chair, can I just ask how long more you'd like me to spend on this? Because I know that I'd like to talk. Just a few more minutes, if that's, yeah, is that okay? Because I know that members are probably at questions. Yeah, that's fine. So in terms of this, I thought I'd give a bit of context of health and social care in terms of the landscape at the present. The biggest factor, as I've said already, on is a cost of living crisis, with increased energy prices across the UK driving unprecedented cost of living pressures up and down the country. So in April, the energy price cap jumped almost 60% from £1,227 to £1,971. The cap will soar to around £3,549 a year in October, which is a further increase of 80%. But this is not an absolute cap. It's based on unit costs. If this rise does go ahead, then the average low-income family will pay 4.5 times more for energy in 2023 to 2024 compared to 2021 to 2022. Many low-income families will be in an impossible position, being asked to pay their entire income after housing costs for energy. This is all based on an analysis by the Joseph Rowntree Foundation. Meanwhile, wider prices are rising at a pace that has not been seen for 4 decades. We're particularly hard hit in Birmingham here, with over 300,000 people already in poverty, and at least the same again will struggle to pay their bills. There's high unemployment and low employment rates, and a concentration of poverty in key ethnic groups, especially the Pakistani and Bangladeshi heritage families. We're exploring how we focus grants such as the household support grant to support citizens experiencing hardship, and directing our community resources during this crisis to those most in need of support. It may mirror the approach that was used during COVID, where community services were redirected to support people through the crisis. And set against the backdrop of the pandemic, many small businesses, self-employed people or businesses in those industries hit hardest by COVID, and the lockdowns might find it difficult to survive in this latest challenge. So at a time of year when services are usually more stable and better able to meet needs, the system finds itself constantly operating in a bit of a crisis response mode, which is usually only seen during the depths of winter. And now that we've got the winter period approaching, there'll be added pressure such as high levels of vacancies, exhausted staff, and unprecedented numbers of people on waiting lists or presenting for support continue to drive levels of demand. Further challenges are going to continue to come with the political instability that we find ourselves in, as we've just got a new Prime Minister and a government is going to be starting to get settled in. And with that uncertainty, there may or may not come a direction of change. The government's already set out several planned changes to the way that adult social care is funded or paid for by individuals, and how its workforce is developed, how mental health and liberty protection works, and pilots for different models of care. These plans of reform are starting over the next 2 years. And as I said, that they're taking place against a backdrop of really extremely challenging circumstances in relation to increased need. with more people waiting and less staff available. There's a lot more detail around this within the report that's already been provided, and there's so much more that I can talk about in terms of work that goes on within this portfolio, but I am happy to stop there, and I can see whether Graham or Mary, if there's anything else that they'd like to add at this point before we take any questions from the committee. The purpose of this sort of slideshow was just to give you guys an idea of what key areas I see as my priorities, and hopefully the next time I come to committee, I'm able to give more of an update on things that have taken place since this meeting. But also you've had a detailed report that gives an idea of the various different pieces of work that are already taking place, most of which started before my time. Thank you, Chair.
Okay, thanks for that, Councillor Collins. Appreciate it. Graham, Mary, do you want to actually make comments now, or do you want to go for questions and lead in?
Not from me, Chair, thank you.
I'll take questions if there are any.
I'll give them just 20 minutes again. Councillor Morgan, Councillor Kelso.
Thank you, Chair. I'm grateful to the cabinet member going through priorities for the forthcoming year and hopefully longer since she remains in post, which pretty much covers most of, I think, the important issues at the moment. So there were three questions I particularly wanted to raise. The first one is in relation to her food strategy, and particularly relevant with the rising cost of living, because obviously there's clearly a desire for people to eat healthier. That makes sense, but often eating healthier is more expensive, and quite often junk food is cheaper and easier to cook as well. So, and I'll admit myself, I still live like a student. So I know it's very tempting to just shove something in the oven rather than actually sit there and prepare a meal, and particularly going to throw that into people who've got families and other commitments as well that they need to juggle. So what's her food strategy going to do to ensure that people can eat healthier, but it's also affordable? It's very easy to say everyone should go out and buy vegetables and fruits and the rest of it, but actually that's not necessarily easy, particularly if you're struggling on a low income, and obviously with the cost of food going up as well, that's going to be more challenging. So what's going to be done to ensure that her plans for people to eat healthier is affordable? The second one, obviously, again, relating to the cost of living, is quite rightly a lot of residents and people in work will be struggling with the rising costs, particularly energy, which is touched on. But something that was alluded to in the cabinet report, but she didn't touch on, was about care providers, because obviously they have to pay for the energy that they use. They're very vulnerable people. They often have heating and all the rest of it, so they have very high energy bills as it is. And with the rising costs, which are not covered by the cap, businesses are not covered so far by the cap, but hopefully there are plans in place to address that. But I am concerned that there may be care homes at risk of bankruptcy or falling into administration because of rising energy costs. So what work is done to identify any homes at risk in Birmingham? And are there any contingency plans to ensure that those people, should care homes go belly up, that they are able to continue to receive care in another setting as soon as possible? Because clearly what we don't want to find is that 10 or 20 care homes all go bust at the same time and we've got nowhere to house them. So clearly those care needs will continue regardless of whether the home exists or not. So has it been in place to identify that? The final one is in relation to monkeypox. I appreciate the cabinet members have been providing updates on that, and I suspect there's another one due soon because they're normally towards the end of the month. So, but we haven't had September's as of yet. But I recall from the previous one that they're expecting another delivery of monkeypox vaccines soon. Do we know if that's arrived yet, or if there's any plans? Because I know it certainly is an issue for the LGBT community. However, there's any awareness planned around to monkeypox, given its Pride this weekend? Given the potential for a large number of LGBT people who are identified as being at risk from monkeypox, has that been factored in? And clearly what we're going to do to ensure that the vaccine doses, as soon as they arrive, are sent out, as it were, as soon as possible. Thank you, Joe.
Thank you. Thank you, Councillor Moore, for your questions. So the first question around the food strategy and the cost of living, you're right in saying that eating healthier definitely does end up costing more than it does to have the easy option of junk food. And you said that you still live like a university student. If I didn't have children, I would probably still be in the same boat. I do try my best to kind of take out that time and prepare healthy meals at home. But I'm not going to lie. I think the other element or the barrier that working people face when it comes to preparing healthy food is the time constraints and the issues around that. And these are exactly the conversations that have been taking place within the Creating a Healthy Food City Forum. In terms of, I literally raised those issues towards the end of that meeting, because I try and pause to hear from other people first and then just kind of chip in to see whether there's anything that's kind of missed off. And the food strategy, the consultation, obviously, like I said, is just ended 2 Sundays ago, and officers are having a look at what the feedback from the consultation is. But what I think there's 2 different things here. So one is the wider strategy, which will obviously be a bit more of a longer period of time. But the initial thing around taking into consideration what the impact for people in terms of the winter pressures and the cost of living crisis that we see as a very much of a short-term emergency kind of situation. I don't have an answer in terms of this is what we plan on doing. I wish it was that easy, but definitely not a cop-out. What I can say is that those conversations with the right people around those tables are currently happening and taking place. We've got people from the different various, food justice network, food organisations that have committed a lifelong commitment into looking at this around fresh food, affordability, accessibility, and they're all working either together within this forum or with other people outside of the forum on what can be done, including some of the things around working with supermarkets and lobbying them as well. So there's a lot of work that's being done, and that's a thought out process. And we definitely, the other thing I can add is that we plan on, I know that you're a different political party to me, but we will be speaking and lobbying government as well. And one of the things that we've highlighted and we've discussed already amongst members of that forum is to ensure that we don't see as there's a cost of living crisis and there's an emergency situation. We need to make sure that people are just fed. Let's feed them anything. It's not a case of let's make sure that they're fed and not starving, but let them have further health implications down the line that we haven't thought about, such as diabetes and other things, if we're giving them the cheapest options and not allowing them to have healthy lifestyles and sort of, leading them down a track just because we're in an emergency situation. So those thoughts are already kind of being discussed, where we're very much clear that we recognise that we want people to have healthy options, and just because it's an emergency situation, we're not just expecting people to eat absolutely anything just for the sake of being fed. I don't know whether that answered your question, but it's just to let you know that this is definitely on our agenda, and I recognise and understand the seriousness and the concerns that you've raised. On the second question around energy costs and care providers and bills and how it's not being covered by the cap, I will bring Graham in if that's okay in a moment. But what I can say is that we've already started having these conversations. I'm speaking to officers within adult social care around exactly that. And just ensuring that all of our providers, whether it's a council providing a service, whether it's our commission providers, are being supported during the process. I know a lot of work has been done when we're looking at the fair cost of funding, which is one of the things that have been detailed in the report around exercises, working with our service providers on what they expect the costs to be. So we've already got a lot of information that's come back from that. But in terms of a bit more of an emergency, in terms of your question about if we find that somebody, a company is struggling that much, and what plans have we got in place, and how are we going to ensure that we don't end up in that sort of crisis situation? I'm going to hand that over to Graham, who I'm sure you'll be able to pick that up, because I know that the work on that is being done, and then I'll come back for my next question. Is that okay?
Yeah,
thank you.
So the adult social care has a responsibility to manage the market, which is part of the duties of the Care Act. So we've been doing that since 2014. And we've built up really good relationships with the market over that period of time. Over the last few years, we've engaged in an open book exercise to give us a deeper understanding of the costs that the market faces and the challenges they face. Until recently, I think we've managed that reasonably well. The increases in fees that we've been able to pay, while not probably what the care market would like, at least has been keeping pace with the challenges within what we can and can't afford. I think, though, the cost of living, the fuel costs in particular, are going to make life a whole lot more difficult. So I think the reality is that the relationships we've built up will enable us to have that early warning of homes in particular will be most, notably affected by, obviously, by the cost of fuel going up and so on. And what we will be doing is working to mitigate the impact of that as best as possible. But I mean, I think we all need to be clear, as Councillor Cairns described, the increases in fuel costs are way above, what we can realistically make up, but we can work with them to mitigate the impact. So it's a matter of really keeping a very close eye on them, being supportive, and making sure that when we do seek to increase the fees this coming year, we reflect as far as we can those increases in their costs. I mean, the only thing I would add, Chair, is just to give Councillor Moore, I mean, Birmingham in some ways is going to be not as badly affected as some other areas. I know just within the region, Shire councils are facing huge pressure on their home care because of fuel costs. I mean, essentially, care workers who are on minimum wage in the first place can't afford to put fuel in their cars because they don't get paid for 2 months. So they're handed by contracts. So it's a very, very challenging situation, which I think because of changes we made a few years ago with home care, we've at least mitigated ourselves to some extent and shouldn't face that kind of impact.
Thank you. Thank you, Graham. And Councillor Moore, your final question around monkeypox, and looking forward to my next briefing, which, yes, you will be receiving soon. In terms of the question that you've got around vaccine availability and the rollout, I'm aware that, well, it's not completely certain, but we're expecting for a further rollout across the UK of around 80,000 more vaccines to be announced this month. So in terms of how much Birmingham will receive, I know that our Director of Public Health will be having those conversations and where needed negotiations to see how much of that will come into Birmingham and then be able to be allocated to clinics so that people can use them. In relation to Pride, so Birmingham City Council is hosting a stand at Birmingham Pride with a Be Bold marketing team, and the Public Health Division, as well as the LGBT+ and Allies Network, are working in partnership to ensure that there's a good representation there at Pride. Monkeypox information and support was going to be available at that stand. So if anybody who is attending and wants to find out a bit more about either just general advice on monkeypox or where they can go to in terms of support and further information, then they can approach that the stand that's there. But if you'd like to have more information on that, then I can arrange with officers to get more arrange with public health officers to get more of a detailed information and more health promotion material if you'd like that.
I'm sure the briefing.
Okay, that's fine. Thank you. Oh, sorry, Mary, did you want to add anything to any of the points?
Yeah, so I'm health protection lead for public health, and so I have conversations with the NHS twice a week. At the moment, we are able to get as much vaccine as we need. You may be aware that about a month ago, we introduced what we call fractional dosing, so smaller doses given slightly differently, based on some initial work that was done in North America. And that means that the amount of doses we have are actually able to go further because we give a smaller amount. So at the moment, we have a reasonable degree of confidence that we've got as much dose as we need to give out. And we've done a lot of messaging in the relevant communities. So as much as people are coming forward, we're able to meet the demand.
Thank you. Well, it's a series of comments. I don't expect an answer to all of them, but it just flags up some of my concerns. I'll go back to the start of the conversation that we had at the beginning of the meeting and my concerns about acute hospitals and the ability to move people who are in inappropriately occupied beds out and into the system. We had a conversation 2 weeks ago with Jonathan Brotherton at UHB, and rule of thumb was that there's 160 beds at any one time that are inappropriately occupied. And I think we have a responsibility as a council, as I said, if they're council tenants, to make sure that if there are adaptations required in council properties, that they are done urgently and speedily. And secondly, if there are care packages that are required, that they are instituted immediately, because we've got to get this situation sorted out. We can't have ambulances queuing up and blocking the whole system, and patients that require beds are able to get beds, currently can't get beds because there's just no space. So that is an issue. The point that Gareth made about potential care home closures, I think, is always a worry, because inevitably this is going to lead to early mortality for residents. Older people don't like change. To be told that your home is closing, you've got to find somewhere else, inevitably it's going to lead to early deaths. And I think that, again, we've got a responsibility to try and support as much as we can. Food justice and cost of living crisis, I'll take them together if I may, Councillor Khan. I've heard what you said, and I heard what Gareth Moore said about student living. I never had the luxury of being a student. At 16, it was get out and earn your own living. Like many people of my generation, having worked in the fresh food industry for some time, I would challenge, and I really mean challenge, the affordability of easy cook meals from supermarkets compared to fresh produce and the ability to prepare them. There is the time element that I accept. However, fresh food is always going to be best, and it's going to be a damn sight cheaper as well. And working with the voluntary sector, I think that there is an opportunity for us and the voluntary sector to work together on this particular issue to tackle food poverty and nutrition. I happened to go through Asda's a couple of weeks ago, and they got a slow cooker for 16 quid. Now, they're going to make a profit from that. It ain't going to be a great deal. But if we can work with the voluntary sector, I think that there is an awareness raising issue. I think there is our ability to help to support the voluntary sector. And if we have to make a little bit of space within our budgets, which I accept are tight, but to get the equipment to the most vulnerable, because at the end of the day, I can remember being slapped round the ear holes when I was a kid because I had half a tin of small Heinz beans. And I know what it's like to be hungry. And the thought of children going to bed hungry in 2022, I just find, absolutely unacceptable, horrible. And therefore, anything that we can do to support families who are in food poverty and children going to school without anything in the stomach. I know there are breakfast clubs and everything else, but it's just the general principle that I think that we have to start to tackle. Cost of living is going to be a problem, inevitably, and I have to say that looking at a wider aspect, I think it could have an enormous impact upon the council's finances because inevitably heat, council tax, rent are all going to go into the equation, I'm afraid. And it could have an enormous impact upon our finances. And therefore, I think we need to formulate policies and support mechanisms that start to head some of these problems off at the pass. And I know that you mentioned support and advice for vulnerable families and people. And I think that is part and parcel of it. I'll shut up now. There's more I can say.
Thank you. It's been really useful to sort of hear back your comments, actually. So thank you for that. In terms of the order that you sort of mentioned your questions and comments in, I'll start off initially around the issues around acute hospital care and the issues around ambulance delays that you've referred to. And then, Graham, if that's okay, I'll bring you in afterwards to give a bit of an updated picture if you can. So I say pretty much very early on, from the moment I became the cabinet member, one of the things that was highlighted, I'd say in the first few weeks, was the issues around the delays, the ambulance delays. And I wrote to West Midlands Ambulance Trust and said that I'd like to meet with them and discuss some of the issues that they're facing, to see how, from a council perspective, what we can do in terms of a joint up approach. Just over, I think, 6 weeks or so ago, I did meet with the West Midlands Ambulance Trust and heard some of the issues directly from them. And, you know, the issues that they've raised, I mean, an example I can give you is that there's been cases where some ambulances have had to be sent back to hospital because the waits have been so long that staff who have been finishing shifts need to go home. Yeah. So they've had to, instead of sending empty ambulances, replacements, to people who need it at homes, they've had to go back to hospital for that reason. And that just gives you an idea of the scale of how big and wide the issue is and has been. I was informed by the West Midlands Ambulance Trust that the new ICS leadership team has been quite supportive since coming into play on the 1st of July. And in a meeting just last week with the Chief Exec of the ICS, we also discussed ambulance delays, and I was informed that it's clearly a big key priority for the ICS, and where there are more streams of funding being explored to deal with the ambulance aspect, the problem is clearly a lot more complex. And we also discussed about how it's definitely more of a flow through the system as opposed to just dealing with the ambulances on the front, because once you get people inside, it's the whole, until they end up where they're best placed to be, whether that be at home, whether that be at a care home, the bed blocking aspect of it will only then be tackled if all the other things are in place afterwards. So this is one of the things that I think sometimes you get issues that are complicated and sometimes you get issues that are complex. This is definitely a complex one because there's so many different various aspects in play here. But in terms of, I know it was more of a sort of a reflection type of comment from yourself, because it's not one that there's any kind of answer to, but I know that Graham should be able to add some more to it.
Councillor Khan, I'm not blaming the ambulance service. It ain't their problem. The problem is they can't get their patients out of the ambulances into A&E, emergency units, because they're blocked, because there's nowhere for the emergency unit patients to go within the system.
There's also lots of other factors in play to add to that, such as staffing, other pressures, and the things that we've alluded to earlier in terms of where the next people move on as well. But if I can bring Graham in, because I'm sure you'll be able to add some insight to that.
Thank you, Councillor Khan. So just to begin to pick up some of those points, I think the first thing to say is that number of people that are inappropriately in a bed in an acute hospital at any one time is down to a whole range of factors, including issues within the hospital itself, issues about people being discharged with transport, with medication and so on and so forth. And in some cases, mental health issues. There's a whole range of issues. And some of the social care issues that you mentioned, adaptations and so on, we are working on that. We've improved our whole performance around that. We've got introduced, for example, Summer Hill Terrace, which means we can get people out much quicker than we did before. In terms of care packages, that generally isn't an issue anymore. It might have been in other areas of the country as a problem. But in Birmingham, we have a service, a contract, which means we can get people out within 2 hours. And when I look at the performance data for that, 95%, in excess of 95% of people do come out of hospital, and they come out either with no package or what we call pathway 1, which is a small package of care. So the stats back up the fact that we are helping to maintain flow throughout the system. I think it is worth, I haven't got all the figures with me, but the big difference we've made is to the early intervention service. I mean, it's a whole system approach, but it drastically improved performance overall. And if we hadn't done that, we'd be in an even worse position, let's be absolutely honest. Because of the introduction of the early intervention programme, we've saved 120,000 acute bed days annually, which is a huge amount. We've reduced the average time to be discharged from acute hospital from 12 to 4 days. So we've reduced that by 2/3. And we've avoided 20,000 plus unnecessary admissions. So there's a huge amount of work is improving the position as we speak, and that will continue to be developed. I've touched on that. The other thing to say is over the past year, because of the introduction of the EI programme, and because we have been at the heart of ensuring that the system works well, over that entire period, we've always managed to maintain flow through the system from a social care perspective. I've always had enough staff in the hospital to enable discharges to take place, and we've always made sure that we have both bedded and home care options in place to maintain that flow. And in that entire period, I haven't had to deal with any complaints in the system. The problem I think we've got is that this winter's going to be worse. If you thought, and it's that kind of thing, if we thought it was bad over the past 2 years, and it has been really bad at times, we've been on the brink, and I think we're all well aware of that within the care and health system. This year is potentially even worse. So we are working with our colleagues in the healthcare system to make sure we absolutely do everything we can to plan for the winter to mitigate the challenges we face. And we're taking a report, both Solihull Council and ourselves will be taking a report into the ICB to say these are the things we need this winter if we're going to succeed and keep the system flowing as a whole. Because where you're absolutely right, if we don't get our system working properly, it's people that suffer. They end up going into a residential home or a nursing home and they didn't need to, and that's, in my view, is criminal. And we've got to avoid that. So all our efforts will be deployed, making sure we continue to maintain and support the NHS in keeping the flow going through the system. No, that's
Thank you.
No, I was just, sorry, Chair. Just wanted to acknowledge the other comments made by Councillor Tilsley around food justice and the cost of living. But I'm happy to take another question from Councillor Pocock and then come back to that if you prefer, whichever way.
If you want to do Councillor Tilsley's.
Oh, can I do that first? Okay. And again, it's not one that there's a clear sort of answer to. Thank you, Chair. But I just wanted to say, I hear your points around the fresh food industry and your sort of expertise. And I'd say that when you say that you really seriously challenge the affordability of easy cook meals compared to fresh food option, but I think that like you said yourself, that the added barrier or challenge of the time element is probably what hits most people, and which is what probably sways them to having the cheaper option of either easy cook meals or takeout meals and all. They're
not cheaper.
Yeah. They're probably not. I think that there's probably it depends on where you're buying food from and what you're buying. But I hear your points in terms of fresh food option probably can be cheaper if there's the time and if people are able to know exactly where to purchase them from, because it just depends again where you're buying your fresh fruit. I mean, if you're buying fresh fruit and veg from certain supermarkets, I won't name any, but if you buy them from certain supermarkets, they may be cheaper compared to others. But in terms of your comments around the voluntary sector and tackling food poverty and nutrition and just making sure that in recognising that they have a key role as well to play in this, I think it just goes back to how the earlier points around the creating a healthy food city forum does have a wide variety of people and stakeholders from across the food industry, including the voluntary sector as well. So they are looped into that. And then again, just to acknowledge the points and note the points that you've said around the cost implications, the potential cost implications on the council when it comes to what we're talking about, the winter pressures and just the impact, and saying how, really we need to formulate policies to just be prepared. Luckily, that's not just my responsibility. I know that those conversations are already taking place within the council executive on how we can be prepared and also be able to provide for people across the city, as well as ensuring that the council continues to run and we're able to do that sufficiently. I think just a final point on the cost of living pressures beyond the council is how small businesses are clearly a big source of employment, and I think that we clearly, in discussions that I've been having with people around the lobbying government, one of the things is around business support being extended beyond the current 6 months offer, which will obviously have an impact as well if that does end up happening. But it ties again with the political landscape sort of changing and to see what is to come in the next few months, given that we've got a new Prime Minister as well. But that's just kind of my response.
To bring that to a conclusion.
Yeah, that's I was going to say, that's just my... Sure. Take Councillor Pocock.
Yes, and welcome, Councillor Khan, to our committee. It's good to see you presenting your portfolio. It's an interesting portfolio, actually, because I've always been a great fan of your predecessor, Councillor Hamilton. But I think what you brought is a much broader focus on public health. I think there's a broader picture of a healthy city maybe we've had before from a cabinet member, which I would welcome. I think the public health service in our city has been a bit of a Cinderella over the years, and I think you've brought it front and centre of your positioning here. So I think that is a positive step forward for the city. A couple of questions. Under the public health dimension, COVID is still here. I think we left the last vaccination programme with about a third of our people without vaccination. What steps are we taking to continue to address that issue? And it extends more broadly than COVID vaccination. Vaccination rates across the city are poor, and I think that's got to be an area of focus. So I'd be keen to know what we're doing to address that issue as we enter the next vaccination cycle for COVID. We've obviously got monkeypox as well, but I think this is a broader issue, obviously, of trying to address the city's difficulties in that field. Second side's a bit more possibly specific to social care. Possibly Professor Betts might be the best person to deal with this very specific question which I have, which is on the new approach to fair funding for care. I think this is right. If I'm right, there's a new package of money. 3.3 million is it? It's coming this year. I'll be interested to know how far is that ring fenced and what is it ring fenced for? This is additional money, and how are we going to use it? And specifically, I was particularly intrigued by the way you've now got a group of providers together to work this through. It's in, I think, page 20 in your report. We too, as a scrutiny committee, have been looking at ways of trying to engage with providers in a way that we've not been able to do up to now. So I'd be keen to know exactly how that particular initiative is working and what prospects there might be for that to be expanded. Our relationship with the sector, apart from it being a supplier to the city, I think has been one that's been very keen for us to develop. It's cropped up, of course, with COVID and care homes. So I'd be keen to know how we're building on that and what the prospects might be to further build on that in future.
Thank you, Councillor Pocock. So your first point around the broader view that has been brought to sort of committee, and I know it wasn't a question, but I'm glad that you've acknowledged and said that, because one of the things that I found when coming into post was realising how much was going on within public health that we just, as elected members, possibly aren't aware of. And I've been saying to officers in most of the meetings that I've been having that, you know, I want to make sure that everybody else finds out about what you're doing and what is happening. So I'm glad that you've been able to sort of pick that up already. In terms of public health and COVID and it still being here, you've asked around the vaccination programme and the work that's being done to continue that campaign. What I can say is that it's not just a focus at the moment. The focus is now sort of, as well as it being on the COVID vaccination, there is a wider health literacy element of this, where we've got commissioned some organisations to go out to the community to work on health and vaccination literacy beyond just the COVID vaccine. I'll see whether anybody's able to pick up, Mary, be able to pick up a bit more information on how that programme is going. And actually, I'll hand over to you, Mary, first, because the next bit is adult social care. That's okay.
Yeah. So it's quite a number of things relating to vaccination beyond COVID. So obviously we still have COVID, and we're still being vigilant in terms of surveillance, making sure that the strains of COVID that are circulating are still responsive to our vaccine. But you're quite right, the vaccination uptake was not as high as we would have liked, and there is obviously work to continue there. What we have learned from that is that some of the ways in which we have persuaded people to take up vaccine, we are applying to other types of other vaccines, but also that the communities and demographics that were resistant to COVID vaccine, we are exploring our listening and learning, because I've focused on COVID vaccine. I joined the council to set up the COVID response team. I now lead the health protection response. The issue for me running into winter is obviously flu. And flu vaccine is all ages, not everyone, it's not universal. But we've also got childhood immunisation, got adult immunisation. So we've done some work with the Royal Society for Public Health to develop a toolkit. So that's piloted in 3 parts of the country, Birmingham being one. And we developed a national toolkit that's being used to see how we can understand and explore what more can be done, building on the lessons from COVID. So working with the NHS system particularly, which is very supply focused. We've got supply, the issue with vaccination obviously is we're dealing with well people. So we're asking them to come forward when they are well to take something that they might not want to take. And so we recognise that we need a number of approaches. One of that ties in with the literacy and health literacy, but we're also exploring behavioural science to see how we can persuade people to take up vaccine, to understand why they're hesitant and they take up vaccine. We are also using we had about 800 COVID champions that we have morphed into more sort of community champions. Some of them are working on vaccination, others want to work on other aspects of health. But again, it's building on that engagement work to improve vaccination uptake. So there are a number of strands that are ongoing. The nightmare situation for me is that we're so focused on COVID and possibly flu that we take our eye off the basics such as measles and MMR. So I am particularly mindful that we don't do that. And so in conversations with the NHS fortnightly to say, well, what else can we do? And we are looking at, cleaning up our data all the way through to what novel approaches can we deploy as we did in COVID, mindful that we don't have the resources that we threw at it for COVID. I hope that answers your question.
Thank you, Mary, for coming in on that. And the second question that you had, Councillor Pocock, was around the fair cost of care. I know there's a bit of a paragraph within the report on that, so you would have had the information in detail about it, but just for information purposes, in terms of the final work around what the council officers are working on, is a deadline of the 14th of October, so that in which we need to meet, all local authorities have to meet that deadline to submit some information on what we think that the fair cost of care, what the fair cost of care should be. And the work is, I think I mentioned earlier in another question that was asked, work has already been undertaken with speaking and working closely with providers, and cost of care exercises have been done. There's a cost of care report being compiled, as well as a spend report that you mentioned, the £3.78 million, and how and the purpose of the spend report is for us to be able to go and say to government how we expect to spend that. But what I will say, I'm not sure whether it's mentioned in the report, is that where we've been allocated £3.78 million of funding for this year's period, and we're expected to have more for 2023 to 24 and then 24 to 25, in this amount is nowhere near what we expect our estimate to be. At the moment, the estimates from various different ways of compiling that, the gap that we currently are working on is around £72 million. So 3.78 million is, you can just see it, drop in the ocean. But in terms of your specific question, I'll hand over to Graham, if that's okay, to see if you'd like to make a comment on the 3.78 million and what we're expected to use it on, or how we're going to work on spending it the best way possible.
Okay. I mean, very briefly, there's obviously this year is the year we've done the work to identify what the fair cost of care is. And we will then work that through and decide what we can afford in terms of fair cost of care. We need to bear in mind the market and the providers have given us their view about what the fair cost of care is. As I said, we've been going through an open book exercise over a number of years now, so we have a view as well. And we will need to bring that all together to decide what we think in Birmingham the fair cost of care is. So this year is really about the year of doing the work and preparing for next year. That small amount of money, it was never intended to fund the fair cost of care, but it does give us the opportunity to do the developmental work and begin to fund some of the things that we think will help going forward. I mean, clearly government will have to identify how much it thinks that it can afford, in terms of the fair cost of care exercise. Because at the moment, the general view from local authorities would be we can only spend what we've been given. I think that's
the 70 million is a kind of indicative figure. What percentage is that over and above what we currently have? Are we looking to have a third more money, if ideally? What sort of proportion is that?
The other income as well. It's probably quite complicated.
I mean, I would have thought we would anticipate increasing fees by about 14 million in the course of a year, not the 70 million that's been put on the table. If that helps give you an idea.
Percentage-wise, what level are we underfunded, which is really what is measured? 25%. Okay. So we're 20.
Again, look at the equivalent chart, we obviously have a lot of income, particularly in residential care.
In headline terms, we're 25% underfunded compared to what we need to be. Is that basically what we're saying?
Well, no, it depends if you think the fair cost of care exercise is up. I mean, you have to be in mind, I'm not suggesting people have done this, but I mean, if you're asked the question about how much money do you need to run a home, you're going to come up with a figure which makes sure you get, and then there's another figure which is what we've been doing on an open book basis, which would give us a different figure. And then there's another figure which is what you can afford. And I think all of those need to be taken into account.
Okay, I guess we'll come back to that when we hear the results. Chair.
Yeah, and it might have, you've kind of touched on this next question in your responses to the previous ones. And it sounds like there's going to be a gap, really, from what you're saying between the government funding and the fair cost of care, whichever way you kind of cut it. And as you said, there's been the discussions there about, how you calculate that in different ways and how much government may or may not give. If there is still a gap at the end of all that, how can it be bridged? And you've kind of mentioned fees as one thing, and there's some things you might not do as another thing, or asking the government to put more money in as a third. Setting all those three aside, and obviously, as you said, there's various issues with all of those. Is there anything else that can be done? Is there anything else you're looking at to kind of bridge that potential gap?
I mean, in reality, again, it does come down to how much government's prepared to fund this. I mean, the government, the fair cost of care exercise is but one element of an overall package of reforms, and there are others which will need to be played out as well. And some of those have got significant costs as well in terms of increasing the workforce and increasing the number of people that are funded by the council. So that this is only one element of the overall package. And what the LGA and the ADAS, which is my professional body, have been saying is if we didn't have a problem with your reforms, clearly, it's down to us to deliver them because it's national government saying this is what we want to happen. But if it does want them, it does need to fund them appropriately. And I think that's the concern. There is going to be a significant gap between what the government offers to deliver the reforms and the total cost of them, and that's what needs to be bridged. The only other, at the moment, if you take the fair cost of care, it isn't a statutory duty to implement the fair cost of care. This is an exercise it's an indicative exercise. So councils are at liberty to say, well, that may be the fair cost of care, but this is all we want to fund.
Thank you. I've got a couple of questions. And I noticed, Mary, I think you were coming back to the committee on the 21st of February to provide a report on immunisation, which I think would be quite useful. And my observation would be possibly in terms of COVID and other immunisations that there's less willingness to get involved in immunisation across the board. So possibly that's something we would want to bring up when you actually come back in February, unless you want to make a comment on that now.
Sorry, just to understand the comment, is that you believe there's less willingness to engage in immunisation at the moment? Yeah, I just thought there was less willingness, both in terms of COVID, but also in terms of flu vaccinations, in terms of getting children vaccinated. There seems to be an increasing reluctance to actually get involved in that process, in as much that COVID's happened now, so don't need to particularly to worry about that in terms of anything involved in that. Vaccinations, and flu is something that I possibly don't need to get done. So I just wondered whether it's a public consciousness issue or a public awareness issue as much as anything else. I think there's clear evidence that there is fatigue with regards to communication, messaging, cajoling around COVID. For the other things, I think it's just going back to where we were before. Recognising that some systems are not quite fully up to speed, but we're dealing with a public that is much more aware about immunisation, and some views may have hardened. I don't know that there's evidence to show that there is less interest or engagement around immunisation generally, but certainly with regard to fatigue, COVID, people are just tired of hearing about it. But the situation with regard to COVID is, unless you've been under a rock, you will know that there's a COVID vaccine we'd like you to get. What we've got to do is to understand why you haven't had it yet, what might be the barriers, and if there are things we can overcome. But with other vaccines more generally, yeah, we can bring that to you in February.
Okay, thank you for that. In terms of the recommission of the Birmingham Council, so I'm quite pleased that's actually getting forward, because as it says down here, you've got approximately 18,000 registered carers across the city. I understand the hub's been expected to take place based approach because it's based in the north of the city at the moment, and there's going to be an expectation that they actually link into possibly the neighbourhood network cities, so it is more practically available across the city. Yeah, and you also looking to develop a a breakthrough sitting service for carers. Is that definitely going to be coming on board as part of the recommissioning process?
That's their intention, Chair.
Yeah. Okay, so that's the end of that one. Then in terms of the recruitment and retention of staff, I think that's been a problem for the city for a number of years. I'm glad to see the options that are coming on in terms of the goals and power payments and recruitment and retention payments. I think there's also a comment that some other local authorities are doing similar things. So I'm just wondering whether how much of it, if you're taking an action and there's other authorities taking a counter action, how much are you getting to actually move forward in terms of actually retaining staff? Because I suppose there's always a temptation. I think if I move to, I don't know, Worcester, for example, it's going to be a better environment to actually work in than it would be in Birmingham. So I don't know if you've got comments regarding that.
Sorry, Kev, comment.
Thank you, Chair. Happy for you to comment on that. Just one thing I wanted to highlight was that since the work around the recruitment and retention of social workers and staff started, I'd say a few months ago, we've already had some positive sort of outcomes from it. One of which is, over 200 individuals had applied for jobs to join adult social care, and from those 200, 100 of them had progressed to the next steps of recruitment, and so far 55 staff have already been employed, and then there's a further 18 people who are undergoing necessary checks. And then on the retention aspect of it, the moment that the recruitment and retention payment was announced for staff, on the top of my head, I want to say around 10, but I'm not sure if it was around, if the figure was on the 10 people mark. So don't take that figure, but Graham might be able to comment on it. We had members of staff who were looking to leave the organisation, but actually they changed their mind after that retention offer was made to them. So I know that what's going on in terms of the messaging and the work around recruitment and retention within this directorate has already, in the space of a few months, we're already on track and seeing positive changes and impact. And then hopefully that will then continue. And what I can say is that the marketing strategy that was used for adult social care to help recruit staff is now potentially being explored in other areas and other parts of the council because of how positive and successful it was, including the social media advertising as well. But specifically, if Graham wanted to comment on any of that.
No, I mean, I think that's all absolutely accurate. What Councillor Cass said, I think the point, Councillor Brown, where you're absolutely right, is you can't just rest on your laurels. You have to ensure that you continue to put in place the kind of conditions, remuneration and so on that staff are looking for. I think one of the strengths in Birmingham is our ongoing practice development. We're very strong on that, and that certainly is what, if we can keep the remuneration levels at the right level, then the fact that we do so well with PDQ and so on, those qualifying, I think will put us in a very good place to retain staff.
Thank you for that. Then just a comment, an observation on the food quality cost of living. I know in my ward, Family Action on a number of food and over doorstep schemes where they actually have fresh food, which is actually made available, and you can buy X amount for X amount of money. I just wonder whether that's something the council sort of can encourage both from that particular organisation, and obviously other people who are actually looking to get involved in that as well.
Thank you, Chair. So I'm happy to take more information and detail on that around that particular organisation and see whether they're either already looped in with people who are working on this, and if they aren't already, then I can ensure that they are, and maybe some positive lessons learned from that organisation might be able to be replicated amongst the partners who are working on this as well.
Thank you. Then the other point which comes to the Equalities team in terms of the Voluntary report, which I'm really pleased has actually moved forward, and I'm pleased that the MPs from Birmingham and Lewisham are getting involved in that in October. Can you give us a bit more specifics in terms of when that's actually likely to be? I know the engagement part has been commissioned. When's that likely to be more moving into actuality? Do you get any particular dates for that yet?
Okay, thank you. In terms of the event in Parliament,
20th
Oh, 20. Thank you. I knew it was in that week, so it's on the 20th of October. And luckily, the Member of Parliament who will be co-hosting it was a previous cabinet member on the council at the time. So she's been very heavily involved throughout this, and we can be rest assured that she will continue to raise the findings of the report where it needs to go, and obviously working closely with colleagues from Lewisham as well. In terms of, I'll bring in officers to see if anybody's got information on when we're expected to not just launch the implementation board, but move forward on that.
Yeah, I think you're actually coming back here in December. We've had a report on that.
On Blackheath?
Blackheath.
Yeah. Okay, that's fine. I didn't know, but I know now.
So that may be.
I'd love to give you some more information then in terms of what's happened since then. But in terms of timescales, I can say that the implementation board and the people are. October is when I was expecting it. But
shall I just very briefly chip in? We are in the process of establishing the implementation board. It has been actually. We have also been recruiting to program manager and support officer graduate role as well. And I must say that it's been a very difficult period of recruitment due to summer, Commonwealth Games, everything else. But I'm kind of pleased to relay that this is now progressing at pace. So we should secure good officers to drive the implementation forward. It doesn't mean the implementation has not been taking place. There's been a lot of activity within the ICS by the Inequalities Board. A task force has been established to lead on specifically on the implementation of those opportunities for action that are aimed at the NHS. And there's been a lot of activity within public health and lots of sort of ethnically and culturally sensitive and appropriate interventions being developed against a number of opportunities for action from the report. And obviously there's the parliamentary event to specifically start raising this at the national level, particularly for the national agencies and departments, government departments that need to support the implementation of some of those findings as well. There's been engagement with NHS England, who have shared this report with all ICSs across the country as well, and requested that attention is paid to the findings, many of which will be applicable across the country. And in October, we're planning to formally launch the implementation board, introduce the community engagement partners that we have contracted to work with us, and basically formally kick off and accelerate the work.
The last point was, I think, relates to a point you raised very early on regarding winter pressures. The report you'd actually got. Would it be possible for us to mention at the site of that report, because that's coming up on the Birmingham Solihull joint loss? I think it's
the 30th of October.
On the October meetings, if you could, that'd be appreciated.
Oh, winter pressures, can I ask, Joe? Did you say, I thought there was a joint loss when it was on learning disability and autism.
There's a number of items on that agenda. There's the Vision for Autism, also ICS financial planning update, and UHB restoration and review of services update, preparation for winter pressures.
Right, okay, I was there.
If you could possibly, that'd be appreciated.
Yeah, thank you.
Any other questions really quickly? Okay, can I thank Cabinet for coming today, appreciate it, and the other attendees. Thank you for the really involved report, and thank you for questions.
Thank you. Thank you.
We need to move on to our next book, because we are sort of running late, which I think is a feedback on the terms of reference. I think I've got some comments to make about that.
Yes, yes. So item 8 on the agenda is the terms of reference for the Children and People's Mental Health Inquiry. The intention was to bring the terms of reference to this committee for public approval, but during the period of public warning, the task and finish group meeting didn't take place. So I've been in touch with members to try and, with the chair, try and rearrange that. I'll get it done as soon as possible. Ideally, let's have a regular chamber and those go back to the next meeting. So I will decide as before. I can review members of the task and finish group who are around the table are Councillor Brown as the chair and task and finish group, deputy chair. Councillor Hartley from the Councillor Pritchard on this committee as education children.
I had one comment about the terms of references was sent around before that working group meeting and then didn't happen. And rightly in many ways, because it's about health and mental health and you know, kind of resolving and trying to tackle that. But there didn't seem to be much about looking at prevention and kind of looking at things further back before people go into, or even people get into, you know, mental health. So I just wondered if there's any way of kind of putting that into the terms of reference. And that was the point I would have made at the working group had we had.
I think that the process that we have is that discussion can happen at the working group, because I think there's quite a lot to discuss around that, and I've tried to shape the scope based on the feedback that I've had from officers and other partners. So that I think it's the place to have that discussion with the task and finish group and then report it back here, rather than trying to, obviously there was time this morning, but that's the process that we've got, and then we'll be a task and finish group meeting in the next few weeks.
Thank you for that. The next section of this is the work programme. Have people got any comments they want to raise on the work programme so far? No? Okay, thank you for that. Date to have the next meeting. The next meeting is scheduled for Tuesday, 15th of October at 10 o'clock. Do we have any urgent business want to raise? Any requests for calling? Petitions? Authority to chair in the meantime. Yeah. Okay. Thank you for your time and attention to that. We appreciate it. Done.